is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Fred O'Neill, who is NMC's Manager of Patient Access, and we'll be discussing actually a new program for the Patient Access Center that we've recently launched. So we're all curious about that, Fred. So good morning.
Good morning, Jill. Thanks for having me here.
Yeah, well, it's great to have you here and to learn how we're trying to improve access to care at the hospital. So before we get started, because this is your first time on the show, I can tell you when I say first, I mean there'll probably be multiple. So tell our viewers a little bit about who you are first.
So my name is Fred O'Neill. I live in Burlington, Vermont, and I've been with the organization just over 2 years as the manager for patient access. I formerly worked at another hospital in practice management.
Oh, wow. Great.
Yes.
So 2 years.
Yes.
It's flown, hasn't it?
It sure has, yes.
Because when you think about the 2 years that you've come, we've done a lot of different things in those 2 years.
We sure have.
Yeah. So tell our viewers, what is patient access? So, because I mean, that's probably confusing. Those are terms we use, but what does that mean to the community?
Patient access is essentially the registration process for our hospital. So we are the first impression team. We are the first people that our patients see when they walk into the door of the hospital. Whatever door they walk in, we are there to register the patient and get all their demographic and insurance information.
So you're at kind of all the entry points, would you say?
Yes.
Kind of the first to see folks?
Yeah, we are in the surgical services suite. We are in the emergency department, so we're there 7/24, 365. We're in the diagnostic imaging, so if you come in for an MRI or a CAT scan, you register with our patients. And now we just recently, 1 year, just over a year now, in the medical office building, the new medical office building, and the medical clinics.
Great. Super. Yeah. So what is a patient access center? So this is something recently launched. So what makes this different than what you're doing now?
So we did a lot of research. It took about 2 years of research to get this up and running, but we felt that there was a great need. We looked at other hospitals, and it's kind of the new wave of the future in healthcare. Having a patient access center is essentially a call center. We operate off the stage, off the main entrances of the hospital. We work in a like a call center setting, and we primarily answering phone calls for all the practices.
So any call that comes in, so if I was calling for pediatrics or obstetrics, or everything would come into one location, and there'd be a bank of people answering those calls?
Correct. That's our ultimate goal, is to answer the phones for every practice. We had to start small, and we so we currently serve 8 of the practices within the organization. So if you look at the old model of registration, you went into your doctor's office and you saw the person at the front desk, and they checked you in. They took your copay, they registered you for the appointment, and then they checked you out when you left.
Yes.
But there's a lot of other functions that happen within the practice. So very often you'd walk in and they'd be on the telephone answering calls, because they were responsible for making sure all the phones were answered. There was a lot of off-stage work that they were doing. They were doing insurance verifications, insurance eligibility. They were handling all the faxes, the incoming faxes, and different referral process within the organization. So we took everything off stage. So that front desk person in the practice can now focus on the patient in front of them. And they don't have to answer the phone anymore. We took all the phone calls, and they're being answered in the Access Center. And we took all the other functions that they don't need to do, because they need to focus on the patient. So now we have a dedicated team of people that are answering phones all day. And they also do a lot of the other functions that that were used to be done in the practice, such as the insurance eligibility, the referrals, managing the referral process for patients.
So if I come into the hospital or practice and I go and I'm greeted by one of your registration folks, what do I expect when I sit down there now?
That you're going to get undivided attention, and you'll get the same registration process, but that person doesn't have other duties to distract them. So it's all about exceptional service.
Yeah, it is. And so with that, I'm sure there's less wait time, right? Do you see that because you've made that change, that there's less people in line to see registration, or has it helped with that flow? Or
so as we continue to grow, the Access Center is going to incorporate more of the registration process. So they'll be answering a lot of the questions that you normally get when you walk in. They'll have that all done ahead of time. So we'll eventually speed up the whole registration process when you check in.
So if I call, so I might be calling for a question or following up on an appointment, or was trying to schedule an appointment because I've been told I need something. So when I make a phone call, that would go to this patient access center?
Correct, yes.
And then what would happen then? What if I have multiple things? I mean, do they schedule me? What actually happens when I make those calls?
Our ultimate goal, and I see this in about 3 years as we expand and build on the other practices, is it's a one-stop shopping model. So the patient calls, we get one phone call, they can schedule an appointment for cardiology, they can check your primary care, and then they can check on your prescription refill, they can connect you with your doctor if need be. So.
Wow, so one call in, I've got questions, and that's really a resource center for me. And then it also sounds like I can get some of my registration done, so when I actually do come in, that's either all taken care of it, or it changes what I need to do when I'm in the moment.
Correct.
So like pre-registration or over the phone?
Yes, eventually we'll be doing the pre-registration process as well. So just making it a seamless experience when you walk in the door of our hospital.
Wow, so that seems pretty slick.
Pretty slick, a lot of work, a lot of...
It hasn't been easy, right? I bet there's been some bumps and trying to figure this all out? Or?
We've got an incredible team.
Yeah.
We have 8 employees that are working in the call center right now, and we only see this growing, but a lot of training and a lot of preparation.
Wow. So for our viewers, it's like we're making the registration process easier, or helping you to navigate the system easier just by making a call, this one-stop call, and we can take care of multiple needs. And then when you actually come in for those appointments, you probably need to do less, and it's simplified in the moment.
Mm-hmm.
Wow. So how long have you been doing this?
We started January 7th, so this is brand new, just under 2 weeks for our organization.
Wow. And so if we actually sat here a year from now, what would you hope to be telling us about this center?
You won't have to be put on hold when you call our organization.
Oh my gosh, no hold?
We're answering the calls within 3 rings, and we're providing exceptional service.
That's fantastic. I know we've been doing a lot of work on the patient experience.
Yes.
And that front door, that first impression, that first contact, if we can make things easier, yeah, that's fantastic. That's what we need to offer. Wow. So how do you get your staff ready for something like this? This is real change.
Yeah, we identified staff members that to work in the center about 6 months ago. We identified the staff. We've been doing training all along. Preparation. Customer service on a phone is very different than in person, so we train the staff on the best practice to work in a call center and the different registration processes. And we provided them with algorithms for each practice, so when they answer a call from primary care, they flip a page and there's a whole set of instructions on how to handle that call.
Because they have to be pretty expert in different things. If you're calling for a primary care appointment and a lab appointment and a orthopedic appointment.
They're all very different.
They are.
They're very complex.
So your staff really has to be expert, and you've given them the tools, it sounds like, in which for the caller to know, wow, they're answering all my questions.
Yes. Yeah. And they handle about 100 calls. Each employee handles about 100 calls a day. So we're looking at
100 calls a day.
Yeah, we're looking at 600 to 800 calls a day coming into our access center.
Wow. So how are the staff taking this? So we've talked about, wow, this is fantastic for the patients. How is it helping the staff in their work?
So we measured our success based on employee satisfaction, and the employees love it. They feel like they have time to focus on one thing and not be distracted by other things going on.
Wow.
When they used to sit in the practices and have to answer phones and have to deal with the patient in front of them or have other duties to be responsible for, now they can focus on taking that call and giving that patient undivided attention.
And even though they're not sitting right in the practice, they still are connected in some way?
Yes.
So they don't feel like, because a lot of times people are like, I want to do my own registration in my own practice because I know my patients and all of this, but now it's in a call center. So is that working the same way with that same feel that they feel connected?
We work extremely closely with the practices that we service. Every day we huddle with the practices. The supervisors from the different practices come in. We discuss issues. We troubleshoot any problems. And yeah, it's a collaboration among the different groups in the hospital.
Wow, that's pretty impressive. So thank you for doing this. I mean, you're talking so easily about it, but I'm sure there was a lot of preparation to get your staff ready for something like this.
Yes, it's been a lot of work over 2 years.
And a lot of partnerships, because you got to work with those practices, and so that's really kind of a real collaboration across the entire system. So what type of training do you do for your staff? When you think about answering the call wherever they might be, how do you ensure consistency and that everybody's getting the same service?
So to be a patient access representative, we go through a pretty intensive training. It takes between 4 to 6 weeks to get somebody trained in the registration process. A lot of it is working in the computer systems. We have a lot of different computer programs to learn. Navigating that is the huge part. And explaining insurance is very complicated these days, and explaining all the different insurances and getting accuracy in how we register patients.
Great. So when patients are calling their practice, they just call the number and it automatically goes to the call center? Or is there something special that patients need to do to access the center?
No, they call their regular number that they always called, and the lines are all transferred directly into the call center. Our goal 3 years down the road would be to have one phone number to call, a central line to call for any appointments that you want to make within our organization.
Wow. This is really progressive.
Yes.
So what's next, or what other things you might be bringing online to patient access, or other things that you've got in your mind that you're going to be doing to continually to improve our service to our patients?
So as I said, we currently service 8 of the 18 practices in our organization. We are slowly growing over the next 2 to 3 years, and we'll eventually incorporate all the practices into the Central Access Center. One thing that's really exciting is the patient portal. So if you want to
thank you for mentioning that.
Yes, if you want to schedule an appointment over the patient portal, it's going to come to the Access Center, and we're going to process those inquiries. So if you don't have the portal already, please get it. It's a great tool, and it's only growing and expanding. The tool, you can check your lab work, you can make appointments, you can speak with your doctor online, and it's an easy, free app that you can carry on your smartphone.
Yes, and I have it. It is so easy. I was amazed. We were showing all of our incorporators how to use it, and it was so easy. So you can go online and have access to your results, and so you can also reach patient access that way.
Correct, yes.
So how do folks get connected with that patient portal? What do you advise folks to do?
The next time you're in for an appointment in our hospital, provide the registration rep with your email address.
Okay.
And they can get you a link to it, and we'll provide you with the instructions right there at the main desk.
That's fantastic. Wow. So our message is we're moving to a kind of a one-call location to make things easier and get you best prepared for your appointment. And when you come in, it's simple.
Yes.
And then you can always go on the portal and check your results and make those connections there too. That's fantastic.
Yeah.
Thank you, Fred.
Thank you.
I know
Jill.
our time just flowed, so you'll be back because we want to hear more about how you're continuing to improve patient access at our hospital.
Great.
So thank you for joining us today.
Yes, it was great being here.
Yeah, I'm Jill Berry Bowen, your host for HealthBeat today. Thank you for joining us, and we're grateful to be able to improve access to care at Northwestern Medical Center. Thank you.